Manchester, responding to the calls of whistleblowers in the state's congressional delegation, Veterans Administration Secretary David Shulkin has removed the controversial co-chairman of a task force to chart the future of the Veterans Administration Medical Center in the city. Shulkin's new choice is Dr. Jennifer Lee, senior advisor to the Secretary of the VI. She replaces Michael Mayo-Smith as co-chairman, who will remain a member. Mayo-Smith is the chief executive of the New England VI healthcare system and was roundly criticized by whistleblowers as someone who had frustrated their efforts to improve conditions there. The move comes a month after two whistleblowers had told the House Veterans Affairs Subcommittee on Oversight and Investigation hearing in Concord that they tried for 2 years to get administrators to pay attention to their complaints. As I said to Secretary Shulkin, much of the problem lies squarely on Dr. Mayo-Smith, said Dr. Stuart Levinson, who had been medical director in Manchester prior to resigning in protest last fall. Hopefully, Dr. Mayo-Smith is now being held accountable for his poor leadership. The other co-chairman of the task force is David Kenny, head of the New Hampshire State Veterans Advisory Committee. Veterans Health Administration Executive in Charge Drive. Carolyn Clancy said in a statement a valid criticism of Mayo-Smith's involvement was that it could be seen as a conflict of interest to have a current administrator playing such a pivotal role. Dr. Mayo-Smith served the panel well in its initial formation, but as the regional VI medical director, it's important to have the panel remain independent of his views as it makes recommendations to the Veterans Health Administration on the future of VI healthcare in New Hampshire, Dr. Clancy said. The task force meets next week and must issue a report of its findings to Shulkin by January. Representative Annie Custer, D. New Hampshire, had arranged for the House subcommittee to come to New Hampshire and she praised this move. I welcome the decision by Secretary Shulkin to remove Dr. Mayo-Smith as co-chair of the task force responsible for identifying necessary changes to improve services for veterans at the Manchester VAMC, said Custer. We know that veterans have faced unacceptable challenges in access to quality care at Manchester VAMC and throughout New Hampshire. Our veterans deserve better, and this task force should carry with it the weight necessary to enact real change. Senator Maggie Hassan, D. New Hampshire, said the delegation made it clear to Shulkin that Mayo-Smith would not be the right choice to help lead the task force. Given the concerns I have heard from members of New Hampshire's veterans community, I appreciate that VI Secretary Shulkin heeded our call to change the leadership of the Manchester VI task force, Hassan said. I look forward to working with Dr. Lee and the rest of the task force to ensure that New Hampshire veterans receive the full service care that they need and have earned. In the past, Shulkin has responded to calls for action at the Manchester VI. After the Boston Globe Spotlight team report on conditions in Manchester last July, Shulkin removed and reassigned top management to other jobs in the VI. Shulkin also put on the task force to replace Dr. Mayo-Smith as a member of the panel Major General Gretchen S. Dunkelberger, retired from the Air Force. Her experience as senior medical officer for the Air National Guard Medical Service in time with the New Hampshire Air National Guard will make her a valuable member of the task force, Custer added. I'm hopeful that with the addition of these esteemed individuals the task force will be able to provide trusted guidance for how we can improve services so that our veterans can access the care they need and deserve.